Hi, I'm Dr. Brian Kaufman. I'm a family doctor turned CLL patient here at iwCLL in Sydney, Australia, and it's my great privilege to be with Dr. Kanti Rai. Dr. Rai, do you want to introduce yourself?
Yes, my name is Kanti Rai and I come from New York. I'm affiliated with the North Shore Long Island Jewish Health System based in Long Island. And I think that's it, introduction.
And you worked in CLL for the bulk of your medical career, and I'm sure you've seen some significant changes over the decades that you've been working in CLL. Is there anything in particular that you would want patients to understand or know that you're seeing happening over the decades in CLL?
From the perspective of a patient who currently has CLL, I'm very happy and excited to confirm what they already have heard, that there is a unique era of hope which has started only about 4 or 5 years ago. And today that has become much more of an established fact rather than an experimental procedure. Newer drugs which are different from the classical examples of chemotherapies with which we have a dread against, but those new drugs are creating hope for people who had failed all the standard chemotherapies of recent past. Not only that those drugs which have recently been approved by the FDA in the US are now going on from a previously repeatedly treated, bad prognosis group of people to frontline treatment with these drugs. And that second part is something that I feel particularly excited about, because it gives us a hope of not only achieving a good quality remission, but if we are smart enough, in the next 2 or 3 years, we can combine the newer drugs with the chemoimmunotherapy and achieve what we have failed to achieve in the last 40 years, a cure. Because in the recent past, the only cure that was achievable unfortunately required a matched sibling stem cell transplant, which carried horrendous toxicities and not a certainty. Maybe 30-40% of transplant receiving people had a long-term survivorship and some even cures. But now, with combining idelalisib or ibrutinib in frontline with some chemotherapy and newer drugs that are currently in trials, the IPI drugs, ABT-199 drug, Acerta drug, they all are opening hopeful doors for people for whom we did not have much to offer as recently as 2 years ago.
Dr. Rai, it sounds like it's a tremendously optimistic time for the patients and the researchers in CLL.
Absolutely, no question about this. And 10 years ago, I would have made equivocations and ifs and buts. Today, there is nothing, and I am clearly very, not only optimistic, but I think we are almost there.
Is there any advice you would want to give to patients in parting in terms of how to approach their CLL if they're newly diagnosed or if they're relapsed refractory now, that you would want to say to a patient?
For both categories, newly diagnosed as well as relapsed refractory CLL patients, my suggestion is to find out if there are currently active clinical trials ongoing to which you can enroll, because unlike our past history where clinical trials required randomization between placebo and a new drug, now both arms are offering substantial benefit, and therefore the negative parts are virtually absent, and I think only by your participation can we reach the goal of cure faster, sooner, and more established.
Dr. Rai, I want to thank you very much for your time. I always learn so much when I talk with you. Thank you so much.
You are very kind, and it is always a pleasure to work with you.
Thank you.